Welcome back, everyone, to the Safety Burst Conference hosted by Beyond Clean and sponsored by Sertol International. Peggy Spitzer has over 30 years of combined experience as a healthcare provider and an educator. She's a licensed dental hygienist with a bachelor's and master's degree in adult education. She currently is the clinical education manager at Sertol International, the sponsor, like I said, for today's event. Sertol is a manufacturer of detergents and disinfectants for healthcare. She's an infection control consultant for the Colorado State Dental Board and a subject matter expert in infection control for National Testing Agency. I am so excited for Peggy to talk about this presentation. She'll cover the use of references and a checklist to audit department chemicals. So as a continuation on the discussion that we had with Bob Mars in a couple sessions ago, Peggy is going to take that conversation in a couple different directions and a bit further. Another thing I want to point out is Peggy is also going to be a featured speaker at our upcoming dental conference, which you can find out more information on coming up next week on the Beyond Clean website. Peggy, we're so excited you're here. I'd love to turn it over to you.
Thanks, Lindsay. It's very good to be here. Very happy to participate with Beyond Clean. Thank you for setting up this great conference, and especially for a focus on worker safety. So my program is a toolbox for chemical safety, and we are going to be focusing today on managing disinfectants and cleaning chemicals in sterile processing. And as Lindsay mentioned, I am the clinical education manager here at Sertol. That is my disclosure. I am a full-time employee here, and like other companies that have participated today, our focus also is on education and safe and best practices in sterile processing for all products, not just our products. So without further ado, we're going to go ahead here with the program, and you can read the learning objectives. Certainly we're talking about chemical management, but I'd like you to take a look at the bolded worker safety and safe use comments, because today, normally, my programs focus on best practices for chemicals, how to use them correctly to get good results. But today we're really focusing on you. We're focusing on worker safety, and we're focusing on safe use of those detergents and disinfectants in particular. There are so many chemicals, but really our focus today will be on detergents and disinfectants. And one thing I want to say about worker safety, the great thing about using chemicals safely is that it also generally reinforces best practices for using chemicals correctly. So safety and correct use really do go together. One of the things, like Bob did in his program, and by the way, I do recommend, if you're interested in chemical safety for your department, to please check out Bob Mars' program on monitoring chemicals and match that up with my program, because they cover different things in different ways, and both together will help you. Just have a big thermos of coffee or a can or two of Red Bull before you get into chemical safety. It can be a grind. But we will focus on safety data sheets, we'll talk about labels, and we'll provide a template for a chemical checklist that you might be able to use to get yourself started. So, what is your chemical nightmare? Oftentimes our nightmare has been related to damage to a device, using the wrong chemical and damaging a device. Today, I want you to think about using a chemical that has caused harm to your employees, to you or your coworkers. So this is our focus today, is a chemical used incorrectly or a chemical accident that can happen even with correct use, and an employee is harmed. That's our focus today. So chemicals and SPD. What a lot of chemicals, so many different products. But the other thing I want to point out here too is the form of chemicals. So chemicals themselves have certain components and certain levels of toxicity, certainly a wide variance in toxicity between different types of chemicals. But it's also the form of chemicals that can be very worrisome for employee worker exposure. In particular, I'm thinking about vapors, dust. that may be inhaled and you're not aware of it. Bob did allude to that in his program. So some of these things are very sneaky. So it's not just the actual chemical itself, it's the form that it's in. And one of the things that you see on the slide here is actually compressed gases. You may have oxygen, which has relatively low risk, you would think, but when it's in a compressed gas, those canisters are like missiles. They are really dangerous if they're not handled correctly. Now, of course, in our program today, we have limited time, so we have to focus on just a few things. This is not a comprehensive program. We're not looking at all types of chemical safety. We are going to focus on basically detergents and disinfectants. These products are very commonly used. Sometimes we think they're not very high risk, but I think you may have a different thought on that after the program today. So overall, our message is chemicals are useful tools, but they do have risks, and you need to be aware of those. Now here comes our first poll question. So take a look. Don't think too hard. I will tell you up front, there's not always one correct answer. So let's take a look at this poll question. Which is the most dangerous chemical, in your opinion? This is really an opinion. Household bleach, detergent concentrates, glutaraldehyde, or rust removers. Please watch for that submit button, and let's take a look here in a few seconds. Oh, great one. So as we said, there really is not one correct answer. Glutaraldehyde certainly has some higher toxicity issues, and I'm really pleased to see that that was a focus for many of your answers. But as we will go along here, you'll find that there are certainly potential hazards with household bleach or rust removers as well, even detergent concentrates. Sometimes the product that you think is the safest is the one that you may handle without proper precautions, and then it sneaks up on you and becomes the most dangerous. So overall, great responses. Thank you. So chemicals can enter your body in a lot of ways, and some that, as I said earlier, are a little bit sneaky. In particular, lung exposure, that is breathing in aerosols, fumes, mists, and especially dust. This can be a very serious issue, and it's sometimes something you're not aware of. As Bob mentioned in his program, there are aerosols, fumes, and fumes in particular, vapors, that have no odor. And you really don't know, actually, if you have been exposed to that chemical without monitors or other ways to find out. Certainly your skin, you might be more aware of the exposure. The eyes are the ones that I really am concerned about. Be aware of how chemicals can splash into the eyes. It's a very acute exposure, and it can be very hard to handle. You wouldn't think that people would get chemicals in through swallowing or via the mouth, but you have residues that may be on your hands, and then you go to the lunchroom and you're in a hurry and you may not wash your hands very well or at all. This can be a serious problem, so be aware of it. So we're going to take a look, as I said earlier, primarily at detergents and disinfectants. And we'll take a look here at detergents, surfactants, enzymatics, kind of a category that we tend to lump together, along with some other products that we use commonly for instrument processing. So neutralizers, descalers, rust removers, and a whole nother special category that we'll talk more about later, germicidal detergents. Now, one thing that all these products have in common is that they are rated according to a pH scale. And this pH scale can give us a little bit of a clue to some of the chemical risks and hazards for a product, particularly in the case of detergents and these descaler rust remover products. So in general, if you're looking to the acid or red end of the scale here on the screen, the acidic products tend to be those that are used for neutralizers, descalers, rust removers. And I will say that around 2 to 3 is a common pH for what Bob referred to as soda pop. It is an acidic product that you actually ingest. But when you get down to 1 to 2 pH for a descaler or rust remover, and that splashes in your eyes, that's a serious issue. Then at the other end of the scale, around 11, 12, 13, we have our alkaline detergents. And alkaline detergents in general they're very good aggressive cleaners. But if you're using them in the concentrated form, and many of these products that you're looking at on this slide are used as concentrates, that's where the additional risk is. So know your products and know the pH of your products, and especially in the case of concentrated products, to be aware of the potential risk and the PPE that's required for those particular things. And here's one of my favorite stories. I have a rash on my stomach. So we got a call from a relatively new customer, and they were complaining that they'd started using one of our products, and now they had a rash on their stomach. And as it turned out, after a lot of questioning, we found out that this was a long-term employee that had used a previous product, some type of enzymatic detergent, but whatever the nature was of that product, they were using cloth aprons and cloth gowns to do their manual cleaning. And apparently that previous product didn't have as much enzymatic content in it. They got into a little bit of a bad habit of using cloth aprons. And then with a newer product with more enzymatic content, they did develop a rash on their stomach from leaning against the counter, and it was wet all the time. So this is a classic example of chronic exposure. A product can be low toxicity or high toxicity, but exposure over time, which is chronic exposure, can still cause problems. So it doesn't matter whether the product's relatively mild or gentle. If you have exposure over a period of time, that can be an issue. Whereas acute exposure, that's sudden and more dramatic and sometimes more serious. Acute exposure is the classic example would be eye exposure, so a splash to the eyes. Aerosols can also be acute or chronic. And in general, what we're reinforcing here is combined chemical and biohazard safety. When you use your correct protocols and procedures, when you clean under the water line, when you use PPE, you're protecting yourself for both chemical and biohazard risks, and keeping in mind that you are protein. Skin, lungs, and eyeballs are all protein. And that's why we recommend against using latex gloves, especially for enzymatic detergents. It's because latex is protein also. So keep those enzymes where they belong, on instruments, not on you. Now, how about household chemicals? Household chemicals are another sneaky type of chemical exposure. This is sort of familiarity breeds contempt. In other words, you use these products all the time at home. You may or may not use gloves when you use cleansers at home. You may or may not use gloves when you're doing laundry and using bleach. So then in the department, sometimes it feels like that's not really that important. But household chemicals do have risks. You do need to use PPE protection. Now, as far as safety data sheets are concerned, if I'm using a cleanser, let's say like a Comet type scrub agent in my sinks in sterile processing, I do not necessarily have to have a safety data sheet. I should still protect myself. But if I'm using a product like bleach, isopropyl alcohol, etc., that is let's say, a drugstore or a consumer type of product in sterile processing for instrument processing, that should have a safety data sheet, and you do need to have training and labeled secondary bottles where this product may be dispensed in something other than the original container. We'll have more information I hope that we can get to on secondary containers later. So vocabulary. Vocabulary causes a lot of confusion, particularly with a correct use and application, but it can cause some confusion with safety. And this is because in general, we start ramping up toxicity of chemicals as we go from cleaning to disinfection to sterilization. Now, we already know from some examples I've given that any chemical product can have some toxicity safety issues. Even the most gentle, mild cleaning agent can have toxicity or chemical issues. But definitely, as we get up to disinfection and sterilization, we have more toxicity issues that we must be careful of. So for this program, what I am going to focus on is a little explanation about germicidal detergents, what they are, because this is a common area of confusion, and I don't find this covered oftentimes by other presenters, so that it's a clear understanding for you of not just correct use, but also safe handling. So let's take a look at this poll question first. Which type of chemical is generally safe to handle without gloves? So don't think about it too much, just pick one. Detergents, bleach, or disinfectant wipes on the clean assembly side, which one is generally safe to handle without gloves? Think about it, not too long, and let's see what the results are. Great, thanks for your answers. So, a chemical that might be generally safe to handle without gloves, detergents. Well, sometimes we do look at detergents as not too hazardous. Remember, concentrated detergent does present some risks. You should never be handling detergents in your department without gloves, whether they're concentrated or diluted. Handle them with gloves. Disinfectant wipes. This was a sneaky one, and I have to admit that I gave you 3 answers that are basically all wrong. So even on the clean assembly side, you should be handling disinfectant wipes with gloves on. So be sure you're wearing gloves for your disinfectant wipes. There are a lot of different chemicals out there. We'll see a few examples, and some of those are highly toxic. This is the message I want to get across today. Disinfectants and sterilants, even the lower level disinfectants, are designed to kill pathogens and living organisms. And you are a living organism. So be careful with those disinfectant wipes. They are not designed to be used with bare hands. So let's take a look at disinfectants in general. I think this is probably a review slide for most of you. You're generally familiar with the fact that there are low and intermediate level disinfectants that are regulated by the EPA. Now, where do those germicidal detergents come in that we keep talking about? So germicidal detergents can be low level. They're generally diluted with water. If they do not have TB kill, they're considered low level. They're typically used in the floors and the walls, sometimes countertops. They're oftentimes used by environmental services. Frequently, they're ammonium quaternaries, sometimes synthetic phenolics, but in general, they do not have TB kill, and that's why they're low level. Other types of germicidal detergents, which in my opinion are more appropriate probably for sterile processing, are intermediate level. And the reason that they're more appropriate for sterile processing is because they do have a TB kill claim, which is a CDC benchmark. And that's especially in the presence of blood and body soils. So germicidal detergents regulated by the EPA, usually a concentrate that is diluted with water. They're generally good cleaners. They can be low level or intermediate level. And if they're intermediate level, there should be a TB kill claim. Always look for EPA registration on your germicidal detergents. Now, the other thing to be aware of is that disinfectants in general can make cleaning claims, but those cleaning claims are not tested by the EPA. I will say that again. Disinfectants are registered by the EPA for killing, but they are not necessarily tested for cleaning. What this means is if you have a disinfectant product in sterile processing that's ready to use, it may or may not have water content or surfactant in it, and especially if it's high in alcohol, which, many disinfectants have a lot of alcohol. It's a great killer, good disinfectant product, but it does not clean as well as water-based products. But then that also takes us to a whole nother issue, which is this third column to the right, actives. There are many different chemicals in your different disinfectant products. And I just have to keep emphasizing, please understand that your disinfectant sprays and your disinfectant wipes that many of you use in your department, they can be many different kinds of chemicals. Some of them have alcohol, some have no alcohol, some are bleach-based, some are quaternary ammoniums. They're just all over the place. Do not assume that your particular disinfectant has certain ingredients in it. You need to check the label and you need to check the safety data sheet. You also need to understand if these chemicals are compatible with the surfaces or devices that you're using them on. So be aware of those many different types of chemicals and the issues that may or may not be present. So hopefully that helps you understand germicidal detergents. Must be EPA registered, have to have a kill claim, may not necessarily be tested for cleaning properties, and water-based concentrated disinfectants, generally speaking, tend to have more cleaning properties, but EPA doesn't test that. High-level disinfectants, of course, are FDA cleared. There's a couple examples there. There are, of course, many other chemicals that are used for high-level disinfectants. So we're going to see a video clip here for a disinfectant label.
Disinfectant labels can be hard to read. There is a lot of information. What do you need to know? First, look for EPA registration. This tells you the product is approved and the kill claims are backed by lab testing. Next, check your product expiration. When it comes to disinfectants, do not use expired product. Check the label. Is this product ready to use or concentrate? If concentrated, find directions on how to dilute. Concentrated disinfectants must be diluted correctly to kill germs. Wear gloves and eyewear while handling concentrate.
So the most important point about that video was the importance of handling concentrated disinfectants with PPE. So be sure that you're training yourself and your team to have the correct PPE when you're handling concentrated disinfectants. And then, of course, knowing where to find things on the label. Because, and for those of you who are looking at your audience view, you may want to enlarge the slide on your view. And I wish I had a pointer so I could explain some of the parts of the label. But when you look at a label like this, you're thinking, oh, how can I even find information on this label? Disinfectant labels are so hard to read. And what I'd like you all to understand, as I represent a manufacturer of disinfectants, I will tell you that the EPA controls label content for low and intermediate level disinfectants. There's frankly not a lot of wiggle room by the manufacturer in putting content on these labels. So we end up with tiny, tiny print and trying to squash everything on there for you, the consumer. So I just want to apologize for how difficult these labels are to read. But from a safety standpoint, I will tell you that there are warnings, there's safe use instructions, there's PPE, there's first aid. It is there on the label, it's just hard to find. So you do need to be aware of that and make sure that you and your team read these labels and understand the safety issues and the hazards. Now, one thing that people may not be aware of is that disinfectant labels, at least the low and intermediate, will typically not have pictograms. We're going to talk about pictograms in just a minute, but the reason is because the EPA does not allow them. The pictograms will be on your safety data sheet, but they're typically not on the disinfectant label because the EPA does not allow it. So we'll talk a little bit more about where we can find that chemical information on your safety data sheet here in just a bit. So what about high-level disinfectants? I would strongly recommend that you do take a look at Bob's presentation from earlier about the high-level disinfectants and especially the gas sterilants, the low-temp sterilants, because these are high-risk chemicals. They do have a higher toxicity level. There's a lot less margin of error that you can have in handling these products. So do prioritize them when you're looking at the chemicals in your department. I won't give you a lot of specifics about this, but I do also want to mention that there's sometimes some confusion on the IFUs, particularly for devices that are used to flush scopes and other devices. So you have a scope flushing device that has tubing, And this tubing obviously gets contaminated. It may be single use or it may be reusable, but if you've had detergent flowing through that tubing, then you do need to rinse that tubing according to the device IFU. And occasionally we have seen IFUs that recommend using glutaraldehyde as the cleaning agent for the tubing after detergent. This is a problem because there are interactions between chemicals, particularly between detergents and glutaraldehyde. So be sure you clarify this with the device manufacturer and understand the correct use of the chemicals for each step. I also, in general, recommend that you clarify the use of rinsing with water between different types of chemicals. Be sure to check that, of course, always with your device manufacturer. Certainly, high-level disinfectants are a high priority for surveyors. They're typically looking more at the correct use rather than the safety issues. Now, what about sterilants and gases? Well, Bob covered that very well, and so I won't say too much about that other than this is a high-risk area. You need to be on top of it, and you definitely need to be monitoring. Now, here's an explanation, a little bit more explanation about the difference between chronic exposure and acute exposure, and that OSHA PEL or IDLH that you may see on safety data sheets. So here's my little 5-second explanation, very oversimplified. And then you can certainly get more information from other sources. And that is the PEL, the permissible exposure limit. That's your exposure over a period of time, typically a work day of 8 hours. And what is the allowed limit? That would be a chronic type of exposure. Then there's the NIOSH IDLH, which is the immediately dangerous to life and health. That's an acute exposure. So the bursting of a cartridge or a sudden exposure to your face and eyes. Now, one thing I do want to point out here is that you can't assume that any product is safer than any other product. Take a look at the acute exposure limit for ethylene oxide versus the acute exposure limit for ozone. And that alone should cause you to listen again to Bob Marr's presentation about monitoring chemicals, because it is a dangerous issue and you need to be aware of it and monitoring. So here we have another poll question. Mary is an employee in your department. She splashed disinfectant in her eyes. Why do you think this happened? So this is totally your opinion. Don't overthink it. Just why do you think Mary splashed disinfectant in her eyes? Is she new? Did she not wear her safety goggles? Was the container not labeled? Maybe she didn't even know what was in the bottle. So pick the one you think, and we'll talk about the results. Okay, great. And of course, this is another one where there wasn't really one specific best answer. She certainly could have been new and didn't have training, but nobody picked that. I really like the one that you all did pick, which is not wearing your safety goggles, because that would have been the absolute protection. But let's be sympathetic. Mary was trying to read the directions on that crazy disinfectant label, and so she took her goggles off. So it's certainly any of those are plausible. And I'm sure that all of you have experienced some of that at one time or another. So chemical risk factors, we're going to talk a little bit again about that acute versus chronic exposure. What I really want to emphasize here is that they're both a serious issue. Acute exposure is the thing that frightens us more because it's sudden and it could be very high toxicity and really dangerous. But again, it doesn't necessarily relate to the actual chemical toxicity level. If I splash something in my eyes and it's an acute exposure, it doesn't make me feel too much better that it was a very mild type of chemical. It went in my eyes, and that's acute, and that's scary. A chronic exposure can be very sneaky, but it could be something that's highly toxic, like those sterilant gases, but it occurs slowly over a long period of time, and you just don't realize it. You couldn't smell it, you couldn't feel it, but over time it still damages. So I will tell you that they're both serious. They both need to be considered as chemical risk factors, whether it's sudden or chronic over time. And any level of chemical can cause acute or chronic issues. Certainly mixing two different chemicals. Here's the thing, with chemicals, unless the directions for use specifically require mixing two chemicals, this is something you really need to talk about with your department. Make sure that people aren't using chemicals in sequence without rinsing or otherwise removing them in between. Because when chemicals are accidentally mixed together, there can be really bad results. There can be, of course, outgassing or actual toxicities from the chemicals, or sometimes there's just bad results that interfere with cleaning and sterilization. So no matter what, really consider this whole issue of mixing chemicals either on purpose or accidentally in sequence in your sterile processing department. And then we know that there are high-risk chemicals. We know that there are products that are very important for us. We know we have to use them, but they may be known carcinogens. They could be really strong acids or alkaline, as we discussed earlier about those alkaline detergents. These are all products that are essential for our everyday function. We have to have these chemicals in order to accomplish our work, but they are definitely risk factors. And of course, those newer temporary workers are the people that have the most potential to get exposed. This is just a review again of that pH scale. So keeping in mind the low numbers are acidic, the high numbers are alkaline. Take a look at that on section 9 of the safety data sheet. Know what your chemicals are and know their pH. Now we're going to take a little bit of a quick look at agencies. We saw this earlier in Marianne's presentation. Now we're looking at this from the focus of worker safety. So when we look at worker safety, OSHA's king. And the thing I want to remind everybody here is that there are two big standards that come out of OSHA that affect us all. One is the bloodborne pathogen standard. That's, of course, all the issues about needle sticks and keeping ourselves safe and avoiding HIV and other bloodborne pathogens. The hazard communication standard is a whole different standard. That's all chemicals. So two standards, you need training for both. There are two whole different sections, two whole different rules. Bloodborne pathogens and hazard communication. This program, of course, is focusing on hazard communication standard. As Bob mentioned, the 29 CFR 1910.1200. NIOSH is another important agency, not the force of law necessarily like OSHA, but they do a lot of research, they issue references and guidelines, and they're really an entity of the CDC. So the CDC and NIOSH are very important agencies. They issue a lot of guidelines that may be referenced in state law, but they themselves are not a regulatory fining type of agency. They don't do enforcement like the OSHA does. And then, of course, we have the EPA and the FDA. The EPA, we mentioned earlier, that's your regulator for your low and intermediate level disinfectants. They also will regulate hazardous waste disposal with either state level or federal level regulations, depending on the state that you're in. Be sure you know that, what regulates or what imposes regulations in your state. The federal agency, FDA, is primarily a concern to us because they're regulating the formatting for those device IFUs that we depend on so much. And of course, they regulate high-level disinfectants. Finally, AAMI. Normally we're really super focused on AAMI. AAMI standards, so important for compliance and correct use. AAMI, however, although they do have good guidelines, they are not a regulator of worker safety. But I would like to point out that AAMI has actually a couple of really great guidelines that many people are still not familiar with. These are technical reports. They don't have quite the same development standards as the actual AAMI, like ST79. But these technical reports are so helpful. And I do recommend that you take a look. Hopefully your department or facility will purchase them. AAMI Tier 67 and AAMI Tier 68. Both very helpful, two a little bit different sections, one for high-level disinfectants, the other for low and intermediate. They can help you organize your department for the correct use of those chemicals. And as we said earlier, correct use and safe use overlap, and they really both support each other. Now, this is a poster that everybody should have seen sometime frequently in your work life, because This poster should be up in every work site. It is the basic job safety and health OSHA poster that it tells you your worker rights. Now, a lot of things that we've been talking about OSHA, both in Bob's program and my program, we keep talking about you. You should do this, you should do that. Well, what I want to clarify here is the OSHA hazard communication standard is really directed at your employer. It's actually your healthcare facility, your employer, that is responsible for doing all these things. So it's your employer, the hospital or clinic, that should be doing the chemical inventory, putting together a written program, providing the PPE, et cetera, doing the training. Now, every facility has different levels of staffing and focus. Just like Marianne was saying earlier, and Bob and other folks, why don't we have more worker safety? Well, hospitals are focused in their budgets on patient safety. They're worried about risk management for patients. Well, they should be also worried about risk management for the safety of workers. Nothing's going to happen unless you are safe and healthy. If you're not safe and healthy in your job, you can't do the hard work that's needed to protect patients. That's really what it boils down to. But sometimes it is we, the employees, that have to push the priority to our employers to help them understand how this is a benefit to everybody. You may be the person that has to start the chemical inventory. You may have to have an outline for a written program. Your employer may not realize the many types of very toxic chemicals that you're actually exposed to. They don't know, you know. So you may have to start the ball rolling, but it's really the responsibility of your employer. So now we're going to get into safety data sheets. So let's take a look at this poll question. Safety data sheets for chemicals, where are they? So take a wild guess if you're not sure, but take a look at the possible answers and just let us know what you think. Where are those safety data sheets in my facility? Wow, oh, this is terrific. So hopefully you know that, in fact, they are on the computer stations on both dirty and clean sides, and hopefully you have easy access to them. This is the key thing with safety data sheets. They don't have to be in print. They can be both electronic and print, but they have to be accessible. If they're not accessible, they might as well not exist. If you think that the safety data sheets are actually locked up in your manager's office, that's not a plan. That needs to change. So let's take a little bit more of a look at safety data sheets. Bob had covered some of this earlier. You do have to have a safety data sheet on file for every chemical, but more importantly, you have to have the correct safety data sheet for that particular chemical. There is a little trick to finding that. The chemical safety data sheet needs to be updated. They do get updated about every 3 to 5 years by the manufacturer, so make sure you have a current one. It is standardized. That's the global harmonized system that's been in place now for several years. Every chemical manufactured across the world has to adhere to this standardized format. Now, where is this really helpful for you? What it means is that when you're in an emergency, you know you can always find certain information. No matter what the chemical is, you can find it in a certain section, and that's what we're going to look at now. And of course, have easy access and have training. So I've skipped over section 1 here, which is actually very important. Section 1 is the name of the product, and I'll tell you, this is another sneaky thing. You need to look at your safety data sheets and make sure you actually have the safety data sheet of the product, because there are some products where companies have many forms and you may not have the data sheet that actually corresponds to the actual product. So kind of a strange thing that you really need to double check. You have the actual safety data sheet for that particular brand and type of product that you have on hand. And then other sections that are just super important in your safety data sheet. That's section 2, that includes your hazards, your pictograms, and your signal words. Now, what are signal words? They can be warning or danger. I'm not too crazy that they picked those 2 words, but hey, they didn't ask me. So warning is a lower level of risk. Danger is a higher level of risk. You can have any type of chemical, but it will be rated as whether it's a lower risk or a higher risk with either warning or danger. Section 3 is where you're going to look for your chemical ingredients, and not every ingredient will be included. As was mentioned earlier, there can be trade secret ingredients, but if they're hazardous or they're over 1% or some other standard that may be appropriate, they do have to be listed on the safety data sheet. This is especially important for disinfectants because disinfectants will only list certain active agents. It's also super important for detergents because detergent ingredients may not be listed on the label. Now, some of this is going to change soon because we have a movement because of a new law in California, SB 258, that is now requiring listing of chemicals on labels. And because most companies will not want to have multiple types of labels, you will probably in the future see more ingredient listings on labels, including detergents, because it's required in California. Section 4 is a super important section. Make sure that everybody in your department knows where to find first aid information. It's always going to be in Section 4, no matter what type of chemical, always Section 4. Other sections are also very important. You have sections for dealing with fires, for certain types of spills or exposures. You have storage conditions in another section, but a section that's probably a little bit more pertinent to this discussion is Section 8. This is exposure limits. That would be that permissible exposure limit we talked about earlier, and also the NIOSH immediately dangerous to life and health. Those exposure limits have to be listed on that safety data sheet. Section 8 is also important for the recommended PPE. This is where you'll see your guidance for gloves, eyewear, etc. Section 9 is helpful both for chemical safety and for correct use, because if you know the pH of your product, that can be important to figure out relative risk or toxicity, but it also is important for device instructions for use. Many of them specify a certain pH. This is where you can find it in Section 9 of your safety data sheet. Then, of course, there are many other sections of the standardized, globally harmonized system, many other sections with very helpful information. So here's a poll question. Take a look at that pictogram. It's an exclamation. What is it a warning symbol? Bleach, irritant, corrosive, or unknown hazard? Take a look, make a quick guess. Or if you know it, there might be one correct answer here. And then keep in mind there is a next slide where you're actually going to pick the choice, bleach, irritant, corrosive, or unknown hazard. Be sure you submit it, and then we'll take a look. Okay, this was the only one with one correct answer. It is irritant. That is a pictogram. I'm going to go back to that here real quick. That was a pictogram for irritant, which says to us, do we really know what pictograms are? If these symbols are just you're not really sure what they are, you and your team need to know what these symbols are, because the idea is to have warnings for different kinds of chemical hazards without using specific language. So this would be for different languages. It would be for folks that maybe have poor or low reading skills. So for example, the middle top pictogram is corrosive, and it's supposed to be corrosive for either an item or object or your skin. I'm not sure if you can tell, but that one's bar or surface, the other is a hand. There's a flammable symbol. There's a symbol for oxidizers. There's another one for human health hazards, especially cancer-causing agents, explosive agents, compressed gases, and of course the infamous skull and crossbones for the highly toxic chemicals. So if you don't know those pictograms, get that OSHA quick card, get some training for your department. Now here's one that I think can be a little scary or confusing. why is PPE at the bottom or least effective on this hierarchy? So just to simplify it, the reason why this hierarchy is set up is for controls, and this is for hazard prevention and controls. It goes from the things that require the least effort, individual effort, to the things that require the most individual effort. So if you eliminate a hazard or you have an engineering control like a cartridge or a special shield in place, then it does not require individual effort. But the farther you go down this pyramid, the more individual effort is required. So what you don't want to take away from this is that, oh, PPE doesn't work. Because of course PPE works. We must have PPE. It's just that it requires individual effort, it requires compliance, and it requires training and monitoring that people are using the right products and PPE. Also, PPE has many different standards and test standards. For example, masks are rated by ASTM for fluid resistance. Make sure that you're using the right PPE. It's provided in all the sizes that people need. If their gloves are not available in the right size, people don't like to use them. It's just a reality that the PPE has to fit so that people will wear it and use it. And then, of course, don't forget, gowns got to be fluid resistant. So what do I need in my toolbox? There are a few slides here at the end where you'll see references in your handout. So if you don't catch all of this, don't worry about it. It is in the handouts for this program. As we mentioned over and over and over again, you've got to know what you have on hand. The very first step, whether you have your employer on board or not, is you've got to do a chemical inventory. Find out what you actually have in your department. Look under the sink. Find stuff in those cabinets. Make sure you actually know what's hooked up to your washers and cart washers. I have been in facilities that swore up and down that they had a neutral detergent hooked up to their wash cycle, and lo and behold, it was alkaline. So, and these were great facilities too. So be sure you understand what you actually have in your department. It's only after you know what you have that you can get into other things like starting to put together a plan, starting to make sure that you have training. This is something that's going to be a group effort. It's going to require a lot of different people, both within your department, also your safety manager or risk manager for your facility. You may get some help from infection control with this particular issue, but you are going to need help, and you may have to start the ball rolling. So here's our last poll question. This is in regards to secondary containers. So I have a product that was in the main container. I diluted it. I put it in a spray bottle. Does it need a label? So take a quick look, just what you think your opinion is. If you dilute a product and put it in a spray bottle, does it need a label? And please remember to submit. If you dilute the product, put it in a spray bottle, does it need a label? If you're not sure, just guess. Yes, it does need a label. Now, to kind of reiterate what Bob had mentioned earlier, if you dilute, let's say, a detergent, you put it in a basin, and you use it and then you discard it, that basin does not need a label. That's if the product is used by one person during that shift and nobody else is going to use it. But most of our chemicals are used by multiple people. And that's why, by and large, with very few exceptions, if you dilute a product and put it in some other type of container or device, there should be some labeling to let people know what's in there. Even if you think everybody knows what's in the ultrasonic actually acts as a secondary container, and it should have labeling of what type of chemical is in it. So here's your checklist. This is just a template. This is something that you can use just as a general guideline. You add, subtract, but it does give you kind of a general list to follow for things that you may need to be looking at in your department for safety and chemical management. Again, not all on you. This is your employer that needs to be doing this, but you may have to start the ball rolling. Another thing I've got in here is a very brief reference for some eyewash station information. As most of you are aware, eyewash stations have to have easy access. They need to be hooked up so that they are not supplying hot water. They can't be at a wash sink. They've got to be within 10 seconds of the chemical exposure, no obstructions. So take a look, there's some basic information there that's also on your handout. And then finally, a little bit of information about some references. We have some information about HAZCOM and the OSHA website. The OSHA website's gigantic. It is a little overwhelming, but there's a lot of free information, free forms, free templates, very good starting point. Of course, you have your AAMI standards and your TIRs that we mentioned earlier. There's even information on the Joint Commission OSHA Alliance website, which I've given you the link here. And we did check those links recently, so hopefully they're all still working and applicable. But generally speaking, some excellent resources for chemical management. And on behalf of CERTAL, I'd like to tell you I really appreciated being able to spend a little time with you all today, and that we're always happy to receive your questions, even if it's not related necessarily to our products. And of course, if it's a question I can't answer because it's a specific product question, I'll always let you know that. But sometimes there's general use questions that come around, and we're happy to try to help you sort out, well, where should I go to get a good answer for this question? So we're always happy to hear from you. We're really glad that you were able to spend a little time today of your very precious Saturday, or whatever time you are getting a chance to see this presentation. So on behalf of CERTAL and on behalf of Beyond Clean, thank you for your time, and I hope that you picked up some valuable tips from this program.
All right. Thank you so much, Peggy, for that valuable information. We did get some great questions that came in, so I will certainly just dive right in if you're okay with that.
Absolutely.
Okay. The first question says, must the pictogram be placed on all chemical containers that are in their original container?
So I believe the question is, does the pictogram need to be on a container if it's the original container? And if it's the original container, it is the manufacturer's compliance with these standards. Where this probably comes into play is if you have the original container of a disinfectant, and the disinfectant does not have a pictogram on it because it's actually prohibited by the EPA. So if it's the original container and it does not have a pictogram, but it does have the other hazard and safety information, the answer is no. You don't have to add a pictogram to an original container.
Okay, wonderful. Thank you for that. This next question says, as the virus and bacteria have different HLD and sterilization standards, let's see. Let me come back to this one. Have you ever heard of surveyors question technicians regarding OSHA or EPA standards?
I'm sorry, say that again?
Sure. Have you ever heard of surveyors questioning technicians regarding OSHA or EPA standards?
Have I personally heard of that? Not directly. Typically, the surveyor's not going to get into safety issues as much unless they start seeing some compliance problems elsewhere. And then as they begin to see more and more issues, let's say for HLD is a common one. If they see the HLDs being misused, then they're going to start diving into, hey, do you have the safety data sheet? Are you following these requirements from the manufacturer? It may be more their way of approaching, do you understand this chemical and how it should be used? And they're pushing past the compliance. So directly, no, I have not heard about surveyors asking about safety questions. That doesn't seem to be their primary focus.
Okay. On mixing chemicals, would you say that mixing pre-cleaning enzymatic sprays and soaking enzymatic used in decon would be a violation by OSHA standards?
Ooh, that's a great question. And that would probably be more of a correct use question than an OSHA question. In other words, OSHA's concerned that you're using the product for worker safety. That is, that the workers got the correct PPE for both products. As long as you've done that, they're not as concerned, frankly, about you mixing them, as long as there's the manufacturers don't prohibit it. So I would have to say that probably goes more to compliance with best practices than it is safety. And I get this question a lot because sometimes the department uses one brand of enzymatic detergent and a different brand of spray, or sometimes they're both even the same company and they're all enzymatic and they're all neutral. Does it really matter if they've kind of been mixed? I would double check always with the manufacturer of the chemicals before you do this kind of sequencing without rinsing off. But that's probably one of the less worrisome examples.
That's fair. All right, this next question says, as most high-level disinfectants are used in healthcare industry for instruments and other devices, what is the optimum pH range they should have?
Can you say that one more time?
Yeah, it says, as most high-level disinfectants are used in the healthcare industry for instruments and other devices, what is the optimum pH range they should have?
Oh, that's another excellent question, and that will entirely depend on two things. One is the user of that high-level disinfectant needs to be aware, again, from the safety data sheet, what is the pH of that particular chemical, and then that must be cross-referenced to the IFU for the device. And that's who tells you what you can use. It's that device IFU that says, yes, you can use, or you should be using this particular type of chemical with this pH. Now, it's possible that a device manufacturer has not specified the pH for the HLD. And if they have not specified the pH for the HLD, that may not be a critical factor. So there's not one magic pH level for HLD. It really depends on the device manufacturer's instructions for use.
Okay, wonderful. And I'm going to come back to that first question. I think I understand what this question asker is getting at. They're referencing the difference between killing viruses and bacteria and the differences between high-level disinfection and sterilization. And they're actually asking if there's a standard for known COVID-19 instruments, what category should they be placed in, HLD or sterilization?
Ooh, that's another good question. Okay, so we're kind of veering off from worker safety into infection control and compliance, which is, that's still legit. So aside from whether or not we're using our chemicals and our processes in a safe manner, that is always making sure that you've got the right PPE on for whatever chemical you're using, the short answer I'd give you about COVID-19, and that's really the organism SARS-CoV-2, which is a coronavirus. The only good news I have about this whole pandemic is that coronavirus is relatively easy to kill on surfaces. It's not fun if it gets in your body. It's very similar in that way to HIV. Not fun when you have it in your body, but on a surface, it's relatively easy to kill and it's relatively easy to remove because the key there is cleaning. Good cleaning, getting rid of soils, blood. Once you've done a really good cleaning process, then and you follow the device, the IFU, for disinfection or sterilization, whatever they require, you can be pretty assured that you're in good shape with SARS-CoV-2. That's not a big concern. There's other organisms that are much more resistant than SARS-CoV-2.
Okay. Wonderful. And that actually is the last question that came through. Peggy, thank you so much for sharing your expertise. Thank you so much to Sertol International for sponsoring today's event all about worker safety in the sterile processing department. To everyone who's tuned in, thank you for being here. We have the final session of the day coming up in just over 15 minutes. If you have any questions that come into your mind later this weekend or next week, or when you get a chance to rewatch or share this session, feel free to reach out to Peggy. Her contact information is in the speaker bio tool on the right-hand side of your screen. As a reminder, there will be a 15-minute break before the next session. So grab a glass of water, grab a snack, and stay tuned for the final session in today's Safety Burst conference. Thanks, everybody. We'll see you soon.
Thanks, Lindsay.